Good morning, everybody. I call to order the December 24 meeting of the Special Committee on Academic Health. Welcome on this very cold morning. We appreciate all of you who are here in person, seeing us by live stream or on Zoom. I may be a little frosty myself this morning because I lost our bowling tournament last night to the gentleman to my right. So if I'm a little bitter about that, so be it. But still love Jason most times. Okay. We have a few really important items today. So we're going to start off, and three that require approval. Start off with the University of Minnesota governance changes. And we have with us Cliff Stromberg from Hogan Lovells to do that, as well as Dean Toller to make some comments. But our first item is to really review and act on the resolution related to the University of Minnesota physician governance changes. The proposed resolution directs the president and the administration in consultation with the medical school to work with UMP to create a new university integrated governance structure for UMP, as well as an implementation plan. Once those are developed, they will return to the Board of Regents and the UMP Board of Directors for final approval. I will actually turn to President Cunningham to give us the context for these changes, and then we'll go with Cliff Stromberg. Thank you.
Thank you, Chair Wheeler and members of the board. As many of you know, the state of healthcare across Minnesota and beyond is at a major crossroads. The impact on people and communities across our great state is profound and growing. Downward pressures on rates, higher supply and labor costs, growing IT and technology costs, and the promise and results of the latest biologics are amazing, and so is their price tag. These and other demands are putting enormous pressure on operating margins for healthcare providers. Our primary challenge here at U of M is to continue providing the world-class care to every Minnesotan. This challenge is amplified by a growing healthcare workforce shortage. For Minnesotans, particularly in rural, underserved, and tribal communities, the impact of this workforce shortage is devastating. In some cases, the inability to readily access healthcare services can be life-threatening. But I do have some good news to share with you this morning. The University of Minnesota is uniquely positioned to address this greatest healthcare challenges impacting our state, from workforce education and training to research and innovation, and to translating discoveries at the bedside so that patients may immediately benefit from the knowledge that we generate. But we must act now. This morning, you will hear more about the actionable steps to introduce and chart a pathway for our bold vision for the future of the university's healthcare enterprise. With your guidance and support, we can and will sustain and grow our commitment to the health of all Minnesotans. For starters, our new health sciences strategic plan focuses on Minnesota's needs and outlines the university's plans to leverage our strengths in workforce innovation and high-level care for patients. You will also hear about plans to add capacity and expertise to our extraordinary medical school and University of Minnesota physicians team. In doing so, we can unify medical school operations and the clinical practice in new ways as we forge the next phases of the university's health enterprise. By integrating our work, we can more effectively advance the health of Minnesotans and elevate our leadership across the state, nation, and world. So why now, and what's with the urgency? Well, the growing demand for innovative health solutions combined with our state's current and future workforce needs make delivering on this commitment critically important. The end of the mHealth Fairview agreements in 2026, along with ongoing negotiations about a new path forward, also present a unique opportunity now for us to design our future. Creating a reimagined, university-led health system is a monumental public service opportunity and a responsibility. By acting now and intentionally, we will preserve the best of what we do, evolve our approach where needed, and invest in ways that best serve our patients, the state, nation, and world. We owe an enormous debt of gratitude to the physicians, health professionals, nurses, faculty, researchers, students, and staff that have fostered the university's rich tradition of innovation and public service. And we are strongly committed to ensuring the legacy of excellence is sustained for generations to come. Cliff Stromberg is here this morning to provide the board with some key updates as it pertains to next steps. Cliff is widely recognized as a national leader in negotiating complex transactions for academic medical centers, hospitals, managed care organizations, and other healthcare clients. That concludes my remarks. Thank you, Chair Wheeler. Cliff?
Thank you, President Cunningham and Chair Wheeler. It's a privilege as always to be with you. Start with the fact that the University of Minnesota already has a world-class academic medical center. What we're talking about today is trying to create an improved structure that will better support its world-class teaching, academic, and clinical care missions. As President Cunningham said, you have a highly rated medical school and an enormously dedicated faculty. It's our obligation to try to create the structure that best advances their efforts. We should be aware that the current structure of University of Minnesota positions is quite unusual. There are really only a handful of faculty practices that are created like this as a separate corporation outside the university. What we are trying to do in the proposal before you is to create a structure that is more characteristic of many of the leading academic medical centers, such as Emory, Michigan, Penn, Stanford, Ohio, Iowa, and Colorado. And it is hoped that that would better serve all the missions. The university is also at this time, for all of the reasons and pressures that President Cunningham alluded to, going to have to make significant investments in recruitment, strengthening the faculty, supporting the clinics and surgery center, perhaps new facilities. And to do that requires that the university have a level of direct linear control and management over the practice, which it now lacks. So the proposal is to create a more integrated structure. If someone could advance the slides, I think that was arranged, I hope. There we go. We can go to the next one, please. So the proposed structure, and I'll deal with it fairly high level. We don't want to get too legalistic unless questions require us to do so. The basic idea is that the UMP will continue as a 501c3 corporation. The university will become a sole member, corporate member. The operations will be delegated to a board. The board will be somewhat similar and somewhat reconfigured. It would have department chairs appointed by the dean, that is academic department chairs. There will be some faculty appointed by, elected by the medical school faculty to continue their input. There would be executives appointed by the president, which would clearly include the dean and the university CFO. There would also be some outside experts appointed by the president. Then there's a new position of executive vice president for health affairs who serves as a chair, and I'll discuss that a bit more in a moment. And then the CEO of the faculty practice. And then there would be a faculty advisory council, which would allow a broader input than just a few elected physicians. Everyone recognizes that the success of a faculty practice depends significantly on the commitment and buy-in of the rank and file faculty, and they deserve a voice in its decision-making. And of course, at the end of the day, this entity would be part of the university and subject as everything to the Regents' authority. If we can go to the next slide, these are examples. There will be a bit of continued design work. The final and we'll come back to the Regents for approval. But these are customary authorities based upon our consultations with Regents. We feel that you've made the idea that you want continued control over assurance of mission, but you do not want micromanaging day-to-day decision-making, and that's, of course, appropriate. So these authorities are intended to reside in the middle ground. You'd have the authority to approve the mission statement, approve appointments to the board, approve those things that are critical to the success of the undergraduate and residency programs. You would have the right to approve any major action that has a material impact. And that's sort of a catch-all that's common in corporate bylaws. You can't anticipate everything that might arise that might impact the health system. I don't think any of us were anticipating a potential Fairview-Sanford deal a couple of years ago, but it arose. So the regents would, of course, always have the authority to approve major changes. We say here that the regents would have the authority to require a replacement of the CEO if ever required. One wouldn't expect that ever to occur, but you retain that authority. And similarly, any change to the organizational document. So now let's turn just for a moment to Health operations. And to be clear, Health is the name for the corporate entity in which would reside a number of functions. The first is UMP as it now exists. The CFC as it now exists, but potentially being restructured. Importantly, this would be the vehicle for governing UMMC if our ongoing discussions with Fairview come to fruition and the university reacquires UMMC. And then other clinics or facilities that might be created in the future. The purpose of UMMC is to advance all the missions of the medical school and faculty. Attendant to this, there would also be some changes to increase the development of UMP toward a true multidisciplinary group practice. When we formed UMP 30 years ago, it was an aggregation of some 39, as I recall it, faculty practice groups, a kind of polyglot array of different kind of entities. And the idea was, let's be unified in one. And it has evolved impressively in that direction, but it is still not fully an integrated multi-specialty group practice with common strategy and funding and united with the medical school in the way that you can find at a number of academic medical centers. In addition, there are performance improvement efforts underway. That is just, as President Cunningham alluded to, an unavoidable reality of modern life for any healthcare institution. Every institution needs to stretch the dollar farther, improve the delivery of access and quality, and manage costs. And so we are working with, not we, I, but others who are professionals in this area, are working with UMP and university folks and the faculty to try to advance that. And to state the obvious, the faculty are the experts at delivering care and managing patients and worrying about quality and worrying about science and worrying about the deployment of new advances. And nobody has any illusion that these goals can be achieved without serious ongoing input by the faculty in not only those issues, but the structure and operation policies of Health. So that would be continued. If we have the next slide. This is not an org chart, it's an executive leadership chart, but it sort of alludes to the organization. Because, as is very common in many academic medical centers, you have at the bottom three sort of sister sibling components: the medical school, the faculty practice, and potentially facilities or own hospitals. And they have similar overlapping missions, but of course, somewhat different budgets and priorities. And so it's very common to create a unifying executive position here called the Executive Vice President of Health Affairs. And that person is supposed to work with the team to reconcile differences and come to unified decisions that move the mission forward. And that would be the plan here. We could go to the last slide, please. So the next steps are the proposed resolution before you. If it is approved, creating an integrated governance structure, working with the faculty on an implementation plan. We do not expect this to be taking years and years. The goal is that it will be implemented at the beginning of the new academic year, beginning July 1. And we will work upon with the faculty and leadership to come back to you with a final plan for your approval. So Chair Wheeler, that concludes my remarks, unless you have questions that I or I should respond to.
Yeah, I want to thank Cliff for your profound expertise in this area. We are obviously experiencing some audio difficulties, so we're going to take a 5-minute recess so we can correct that, because it's a very important discussion to have, and so we want to make sure everything's working. So we'll have a 5-minute recess and we'll address that. Thank you.
Is it more? No.
Okay, we'll resume here now. Thank you all for your patience, and we hope the issue is resolved, because if the below zero wake up wasn't enough for you, certainly the noise here was. So thank you. Let's go ahead and start with, before we start a discussion, is there a motion for approval of the resolution to the University of Minnesota Physicians Governance Changes?
So moved.
Is there a second?
Second.
Terrific. Okay, let's start our discussion. I'm going to turn to Dean Toller first here.
Thank you, Chair Wheeler, Madam President, Regents. Thank you for your guidance and information as we go through the process. And I am painfully aware that this is a significant and consequential discussion we will have today. I'm happy to report that the UMP board that I chair has approved the resolution unanimously. That was a very good conversation. There was clarity on being tightly aligned with the university, even though, as I said many, many times, the physicians at the UMP practice have always seen themselves as university first. Further, the department chairs in the medical school are energized about the opportunities going ahead. We will have President Cunningham visit with us on Tuesday next week. They are prepared to work on the details on how this is going to work and how we move forward with implementation. And lastly, the faculty of this medical school, and thank you, Cliff, for good comments about the quality of the medical school and the practice. We are focused on patients. We are known for excellence. We are led by clinicians, fueled by the innovation that comes from this university, and dedicated to improving health and healthcare in service to the state of Minnesota. And with this, Regent Wheeler, the resolution is in the materials, and I look for you to direct the process.
Great. Thank you very much, Dean Toller. There further comments or questions? Regent Hitch.
Chair Wheeler, thank you for this really great discussion, and I'm really happy that this is this far. My question has to do with the name. The name is really important. And how did the name get vetted? How did we decide on UM Health? What happens to the old M Health name after the UM Health goes on everything? So there's a confusion. Just some of those questions regarding the name. I know name is really important in branding for the next, whatever this is, 500 years or whatever we're talking about. So hopefully, but that's my question. So I don't know who can answer that, but.
President Cunningham, please.
I guess I can take a crack at it. So this is meant to encompass, to move away from the UMP name and instead to indicate that entity as UM Health. So I don't think this necessarily speaks to what a future brand would be for us in a future state as we go through the further next steps. This is really. So I guess Regent Hipsch, I wouldn't overemphasize the name right now, as opposed to this is thinking about this as a structure and giving it a name that provides a differentiator from the UMP name that we had before into a larger component. It could very well go on to be a branding exercise in some later time, but that has not been the intent here.
Okay.
Yeah.
So this is just the change of UMP to U. So it's not
this isn't meant to indicate the larger university health
Good, that
brand.
answers my question.
We currently are in a partnership with Fairview. We have an M Health Fairview brand. This is not meant to differentiate that in any way. This is simply meant to recognize the governance changes here and how we would talk about that internally. And we could certainly do more work on naming and thinking and rollout, but this is not meant to be a brand rollout. It's meant to be a governance change.
Good. Thank you.
And if my colleagues want to add to that at all, I don't know, Clifford.
Yes, Regent Turner.
Thank you, Chair Wheeler. So just for people out there listening in, what are going to be some of the advantages of this change? Like, what can we see that we couldn't do now with UMP that we will be able to do now with UM Health?
President Cunningham, please.
And I might offer that Cliff may be able to speak to that at the highest level, and I'd be happy to chime in after.
Yeah, Cliff,
Some of
please.
Sure. There's no assurance structure drives improved performance or achievement of goals, but you hope that it conduces to it. And the thought here is based upon what's worked elsewhere, that first of all, UMP faced recently and likely in the future very significant financial challenges. And the university is probably going to have to invest in strengthening it. And that works only if it's within a university governance and structure. Secondly, it should help UMP, the market, it be perceived as not just a separate corporation, but as absolute united university. As Dean Toller said, it has always been seen from a clinical viewpoint that way, an academic viewpoint, but not necessarily from a business viewpoint. We also think the creation of the vice president of health affairs position will allow a more effective integration of the practice with the facilities like the CSC and potentially with hospital facilities by the university. And we also think that bringing in additional expertise, UMP has a terrific board, but the university also has the ability to recruit, executives internally and external experts that could strengthen the governance structure.
Yes, President Cunningham.
And then if I may follow up on that, I think, in our current state, we are, although our clinicians, very much see themselves, as the dean has said, as faculty of the University of Minnesota, undoubtedly. However, from a framework perspective, we've actually been a three-legged stool with a physician practice, a university medical school, and then a health system partner of Fairview. And so what this does is unify two legs of that stool into a more aligned state, which makes us better able to work together to support our faculty, for our faculty to support the mission that we have towards the state. So that's part of that alignment there. The other part of the structure on the executive vice president for health component, as Cliff noted, helps us bring in additional expertise around operations and history and experience in running the clinical component of the enterprise. That, well, we have much of that here. Now is the time to have all of that expertise and to bring that in under a unified governance structure. So that's how it helps us moving forward. I think together those two changes align us, bring us together, and make us a better partner in our current configuration with Fairview. They also make us just a better partner for our ability to serve the state going forward with that alignment.
Thank you, President Cunningham. Regent Turner.
I have a follow-up. So how will this help as far as our co-ownership with Fairview, and would this particular board run the hospitals?
President Cunningham.
So this is separate from our negotiations with Fairview and from what happens with Fairview going forward, but it makes us, if we think of how we can internally have the strongest shop that we can, the strongest medical school and aligned physician practice that we can, this configuration brings that together. In a future state, it would also make us more able to support the governance of a future negotiation with Fairview again, or of negotiations, with other components around the state. And I don't know if Cliff wants to add to that.
No, I guess I would just say you can never promise what future structure you would create for a transaction that doesn't yet exist. But the assumption is that this would be a vehicle that could govern both the practice in the hospital if we reacquired humans.
Okay, thank you.
Yes, Regent Johnson.
Thanks. I would just like to make a comment here. I'm very, very encouraged and very enthusiastic about where we are and where we're going with this. I think the main functionality of any academic health center is the three components that have been mentioned here, which is essentially, in the language, a different group here in the state works, is just practice, education, and research. And those are the things. We have slightly different words on that, but that's exactly the mission. So then all three of those components, if you really want to be an academic center, then what really needs to be is the administrative structure there that's going to make all those things possible, maximize them to the greatest effect. We've been working hard for a couple of years on this. I'm very delighted that we're at this point now, seeing how this is shaping up, that we can do more about controlling our own destiny, making these things work maximally for the university, but for the people that we serve, as has been mentioned many times, whether it's in our practice, education, or research, all of which have helped, and the other work engaged in, which is workforce development, all that. So I think now we're really getting to the place where we're going to be able to manage this the optimal effect. So I'm very encouraged and very positive about this move.
Thank you, Regent Johnson. Maybe a question, Cliff, for you. You said that this separate corporation is an unusual structure. That's what I have seen to be true too. I think there's less than a handful left like this in the United States even. So those who have moved towards this more integrated, aligned system, has the performance and alignment you've seen positive results? So I think that we're an outlier now for the way this is structured, given the complexities and needs of those served by our three-part mission and those doing the serving. So we're a bit of an outlier. I just wonder what you have seen from others. Has the results of the restructuring helped accomplish the goals that you said would create advantages here?
Good question. There's always just a correlation and a causation when you move structures. You can't say that it always succeeds. But a lot of bright people around the country in different institutions have moved in this direction. Exactly as you say, Chair Wheeler, there are only a handful, I think, of practices that exist in the structure of UMP. A number like Duke have moved into the university. There are a few like the SUNY system that are statutorily mandated to be outside. That's the only reason they are. But most of them, they've moved in to integration in two different ways. A number have been absorbed into an affiliated health system, such as University of Pittsburgh or MedStar, and so forth. That poses some real risk to the medical school because the medical school sits there with just the academic enterprise. The faculty practice and the hospital are out there in another. We're not doing that. On the contrary, exactly as President Cunningham said, our goal is to have the academic activity of the medical school and the practice in any hospital all within the university structure with aligned mission. And generally, many of the most successful medical centers, as I mentioned, sort of the Penns, Stanfords, Emory's of the world, have done exactly that. And therefore, they can move funds around, contract with payers on a common basis, incentivize growth through strategic deployment of funds, a variety of other. So generally, I would say that is viewed as the most effective model.
That's really great to have that perspective from your perspective, where you've seen so many things across the whole country. Thank you for that, Cliff. President Cunningham.
Yeah, I want to follow back to Regent Turner's question before to just even state it a little more crisply, which is, this structure, if we were to move ahead with negotiations and indeed, run facilities and run the business operation, would be the governance structure for that, and positions us really well in that regard. But no matter where we go next, this strengthens us. Right. Modernizes us in a way sort of that Cliff mentioned that, many places around the country have gone in managing the healthcare climate that we have. that everyone has.
Thank you. Well, I'll have to say, like Regent Johnson, I'm very enthused about this structural change too. I think we have had 3 legs of the stool, but frankly, this allows those to be working in more concert together and do all the things collectively we need to do in a very challenged healthcare environment, and challenging for those people who are trying to navigate it as well. So with that, is there any further discussion at all?
If I may, Chair
Yes, please.
Wheeler, just say one thing. I really believe this supports our faculty the best. Our faculty and our clinicians are what drive our excellence. And I really view this as a way the university can really align and support our faculty in what they're doing for their important mission.
Great. Thank you very much. With that, there's a motion on the table. All those in favor, please designate by saying aye. Aye. Any opposed? The motion is approved. And I'm going to double down on what President Cunningham just said. Let me express our thanks in advance to everybody from the University of Minnesota's administration, medical school leadership, UMP leadership, and our really fantastic, I've been a beneficiary of the medical school faculty, and the work that you undertake now to create this integrated approach. I'm sure everyone around the Horseshoe joins me in recognizing the critical support that the medical school faculty will be into achieving success, and we appreciate them to no end. So thank you very much for that. With that, we'll go on and move. And thank you very much, Cliff. Your expertise has really helped guide us in significant ways, and we appreciate you. Thank you.
Yeah.
All right. With that, we're going to go on to our next item, which is the Health Sciences Strategic Plan. This is one that we've had before us several times, and now it's here for final approval after having a lot of stakeholder input. So let me welcome to the table the presenters for that, or presenter. Yeah, presenters, there we go. But several have been involved in this, as Dean Toller will elucidate further. But Lori Carroll, the Chancellor of the Rochester campus, has helped lead this. Rachel Croson, our Executive Vice President and Provost, Dean Delaney, School of Nursing, Dean Mays, School of Dentistry, Dean Molgard, School of College of Veterinary Medicine, which, by the way, gave us many of us Regents a tremendous tour just last week of that wonderful school. Dean Pettigrew from the School of Public Health, Dean Penninger, the Interim Dean of College of Pharmacy, and of course, Dean Toller from the Medical School and the Vice President for Clinical Affairs. So we are here to actually act on the proposed and really exciting health sciences strategic plan for the 6 health schools. As a reminder, we reviewed the draft plan in October, but we sent it out for further stakeholder involvement. And since then, the plan has been updated to reflect the feedback from the special committee for continued stakeholder outreach. So there's that going forward. So with that, and I'll remind people, this was a key ask of the Governor's Task Force on Academic Health for this year too. So this team has delivered in big regards. So with that, Dean Toller, would you like to kick things off?
Madam Chair, I am deeply grateful to the Regents and everybody else who has inspired this, including the governor who called together the task force, and you were on the task force as well with Dean Delaney, and it's really gratifying to see this coming to a closure and to a conclusion that will set up us for success as we go forward. It has been a great experience working with Provost Croson over there and the deans, and of course under the guidance and leadership of President Cunningham. And I know that all the deans and the faculty in all the health science schools are eager to get started on this work. Madam Chair.
Great. And I think Dean Pettigrew, you're going to get us started here. Thank you.
Yes, I am. Thank you, Chair Wheeler and members of the special committee. Since we last met, we continue to engage with many stakeholders, as was mentioned, and we worked to improve the strategic plan. We listened, we incorporated feedback. However, our vision remains unchanged. Minnesota will lead the country as the nation's healthiest state. Our mission is to foster a healthier Minnesota through education, accessible care, innovation, and partnerships, and we, the health science deans, are committed to advancing our mission. We are going to achieve this goal by expanding access, by reducing health workforce shortages, and I'll just make a side note that we are intentional with the word health workforce shortages, and this was in response to feedback to uplift the role of prevention in these efforts. We will reduce health inequities by expanding partnerships to reach rural and underserved communities, improve healthcare quality close to home, and transform health outcomes through innovation in prevention, treatment, and care models. As a reminder, the stakeholders we engaged with included community leaders, preceptors in our health systems, health leaders from around the state, including payers, state and federal government leaders, higher education schools, healthcare workers, labor leaders, university funders, and research partners. And within our university community, we collected feedback on the plan through an online survey that was available to everybody across the U of M. We held in-person discussions at faculty and leadership meetings in our health science schools. We gathered additional insight from the Rochester Chancellor and other Twin Cities deans. We also most recently met with the Faculty Advisory Committee on the Health Sciences, and this meeting occurred on November 12th. There's widespread agreement that the university is uniquely positioned to convene essential players in the health ecosystem with respect to workforce and achieving quality outcomes across the state. We are aware that this role comes with accountability for equitable results, for geography, reducing racial disparities in workforce, communities, and patient outcomes. So why do we need to invest now? We know that domestically and nationally, we are facing a shortage of healthcare providers. The pandemic illustrated the significant and sometimes tragic consequences of this shortage. In addition to the shortage of providers, we face a maldistribution that leads to healthcare deserts and significant inequities. And we know the landscape is changing. For the first time in history, the number of Minnesotans age 65 and older has eclipsed the number of Minnesotans age 5 to 17. And in addition to this aging population, our health workforce in and of itself is also aging. Environmental changes are disproportionately impacting the least wealthy and most vulnerable members of our community. Our state's health system is facing historic financial and operational challenges, and as a public university, we are uniquely positioned to fix these critical issues for the state of Minnesota. We are requesting the state to increase access by workforce by approximately 3,000 health professionals, reduce health inequities by training more health professionals to serve in rural and underserved communities, improve healthcare quality close to home by expanding the reach of existing programs and creating new options. We will transform health outcomes through innovation in prevention, treatment, and care models. And with that, I will turn it over to Dean Tolar.
Madam Chair, thank you, Dean Pettigrew. It has been successful, in my opinion, because the deans and the provost have been able to first focus on what anticipated trends in the society are, and some of them you have obviously mentioned. What are the keys to success? What has to be true for us to be successful collectively in this quest? And how each of the goals that are focused, as you so beautifully presented, has its own tactics, its timeline, cost, owner, and in this way, a performance scorecard that can get us there. Madam Chair.
Great, thank you. Thank you, Dean Pettigrew, and thank you so much, Dean Tolar, as well. Before we turn to discussion, is there a motion to recommend the approval of the Health Sciences Strategic Plan?
So moved.
Thank you, Regent Hips. Thank you. Any further discussion? Great. Well, we've seen it a few times, and I just have to admit that, first of all, I love the clarity of this. I love that we have measurable outcomes, and I love the degree of tramping around the state to get the opinions of others that help shape this in its final form. So thank you to all of you who worked on this, and really appreciate the product and the clarity. And we've heard from many, even over in St. Paul, about this is the clearest they've ever seen, us articulate what we mean in service to the Minnesotans. So thank you very much to all. With that, I'll ask all in favor. Do we do that already?
No.
Okay, Regent Turner, sorry.
Oh, I went on Sunday. I visited the One Health or the V Clinic on 25th and East 25th, et cetera. Anyway, and that's when I heard about the One Health Clinic where you combine bringing your pet in and getting your blood pressure checked at the same time. That is, the more I now travel, that is a business model for healthcare that really we should capitalize on, because There are so many people that will bring their dog or cat in and not worry about themselves. And so I am fully supportive of that whole concept. I commend the two schools that got together with that idea, and I really look forward to them. They have a 3-year influx of cash to do different clinics, et cetera. I think they're planning on doing one here in the spring, and I really look forward to it because right now it's they're servicing like the low income, the homeless, et cetera. But I could see that healthcare model really being popular.
Thank you, Regent Turner. I mean, I think that's a perfect example of us and what we can do interprofessionally and probably why we are #1 in the country for interprofessional training. So thank you. Any other comments before we call it? Okay. All in favor?
Aye.
Opposed? No. Thank you very much for all the work. It was a tremendous amount, and you did tremendous good for all of us and the whole state. Thank you. All right. Okay. I will move on to the consent report then, and Vice President Toller will summarize the items in today's report.
Thank you, Madam Chair. The consent agenda today includes 2 reports prepared by our budget office, and it is aimed at the submission to the state legislature. It's all in your packets. Number 1, during the 2024 season, the legislature passed new reporting requirements for the University of Minnesota. The report is now required for anything that university introduces as a new ask. And in your packet, this report is titled Evidence in Support of Appropriation, and it includes the information that you have carefully reviewed on several occasions. I think this is number 5 Board of Regents gathering around the plan, and the plan that you have just approved. Thank you. The second report, also for the legislature, is a similar exercise to report on the funds that we already receive. I will highlight a couple of them. Under Governor Dayton's administration, we were given the opportunity to establish medical discovery teams, and they have been incredibly successful. And we are reporting on that, as well as the School of Dentistry Mobile Health, also very much a support for the state. And from the tobacco tax, there are several schools that get infusion into the base operation. There are also descriptions of funding that went to the School of Public Health for the Cannabis Research Center, and of course, Dean Delaney Center for Nursing Equity and Excellence. I hope these reports will help the legislature and this board to maintain your confidence in our stewardship of the public resources. Thank you.
Great. Thank you for that. And thank you for the accountability report that so clearly outlined, much of what we're doing and the investments made. So let's see, I'll ask you, before I invite a motion to recommend approval, can you welcome to ask any questions, comments, or ask for any item on that consent agenda to be pulled out for further discussion? Seeing none, is there a motion to approve the consent report?
So moved.
Is there a second?
Second.
Great. Any further discussion at all? Seeing none, all in favor?
Aye.
Aye. And any opposed? Great, thank you. Well, with that, this shows why the special committee is so important. I think we did really substantive work involved in governance changes, involved in the strategic planning, and now the accountability we have to the citizens of Minnesota for the accountability of how we use the funding. So I think this is why the special committee, we hope, won't be special anymore. It will just be a standing committee, or as Jason said, we'll go from Pinocchio to a real boy, soon and needed. So our bowling champion, I should say. But anyway, with that, I will adjourn. Thank you very much for attending.
Thank you.
Mayor Wheeler, you're on a